have a new patient who came in from an emergency room. He's self-pay. How much is it? Is that a month or is that for 90 days?
Oh, my dude. What do you do? What do you do?
One of the biggest battle lines when it comes to the president's tax cut and spending bill are the cuts to Medicaid.
What we're going to see is millions and millions of Californians who are going to lose their health care coverage.
We certainly have compassion, but we don't have money.
Good morning, this is St. John Street Medicine team. We are providing with medical health services. We do have a doctor on site.
If Maria lost Medi-Cal, she would be at risk of homelessness again. Healthcare is not something she can afford out of her own pocket.
I don't get paid a lot. Lord forbid I'd have to make the decisions I know some old people got to make, whether it's your medicine or your food.
If Medi-Cal was being run so well, we wouldn't need a $3 billion loan.
People who put their pen to paper don't put the stethoscope to chest. So I don't think people fully understand what's going to happen.
The California state cuts are devastating. We got a big fight ahead of us.
My name is Jesse Hoagland, and I am a physician assistant here at St. John's, and I've been doing it for 10 years. Hey. Hello, hello. Most of these patients are the impoverished of Los Angeles County, those who are undocumented, homeless, and those who don't have the funds to get private insurance. Hello, hello. When someone does not have insurance, it really comes down to what can they afford. If they cannot afford insurance, can they really afford these medications? If I had someone who was having abdominal pain or pelvic pain and I needed them to do an ultrasound and I know I couldn't wait 6 months, I would have to send them to the emergency room, which is even more expensive than just getting the ultrasound. My patients having access to Medicaid is amazing, game changer. So I don't think people fully understand what's going to happen. These are people. These are people who finally got access to things that they need to take care of their health, and they're going to be stripped away for the first time.
For him too?
Yeah. Disculpe, señor, un momento, okay? Self-pay. Bummer. I have a new patient who came in from an emergency room. He's self-pay. How much is it? Yeah, that's not happening. Is that a month or is that for 90 days?
The so-called One Big Beautiful Bill is now headed to the president's desk.
New requirements and restrictions for Medicaid could make it harder to earn its benefits, effectively, experts say, kicking people off.
In the case of Medicaid, the administration and the Republicans in Congress really wanted to find a lot of money to cut in order to finance the continuation of the tax cuts. As the old adage goes, why do you rob banks? That's where the money is. Why do you go after health care? That's where the money is.
We're going to make official the greatest victory yet when I sign the One Big Beautiful Bill.
The approach of the Republicans in H.R. 1 was to create a work requirement in order to remain eligible for the program. And for the first time in history, through explicit policy choice, we are now boosting the percentage of the uninsured population in the United States.
I don't have the luxury of taking off work, going to the doctor without it affecting my income. Today was an example of that. Because I wanted to go to the doctor, I had to miss work. All right, I got an appointment like at 2 o'clock. My name's Vermont Means. I work 2 jobs. Everybody knows the game in California. You want your check or you want benefits? You can't have both. So I'm on Medi-Cal. I'm a 48-year-old black man with health problems and stress.
On average, how many hours of sleep you get?
Less than 5.
Less than 5, okay.
I need to see doctors. I need to see therapists. I need to see people that can help me so I can live. Yes, sir. If I don't have sick leave, that's a bill that doesn't get paid that month. That's clothes that don't get washed. It kills me.
So just hang out here for a second. They're going to come bring you the appointment card.
All right, for sure. Thank you, Doc. Good seeing you, man.
Have you ever had periods in your life where you haven't had health insurance?
All the time. All the time. And that's the frustrating part. I gotta watch how much money I make. If I make too much money, I'm gonna lose my health insurance. And I can't pay Obamacare because that's gonna take even more of my paycheck out. It's scary because it's like you're stuck.
I think you can think of Medi-Cal as like the thing that binds all of these other like aspects of a person's well-being. It's something that's not obvious to a lot of people. If you don't work in healthcare, you don't even know. As a case manager, my job is to build a care plan for every single patient. Hola, ¿cómo está? Bien, bien. Ok, por empezar, tengo aquí el documento que yo sí quería el medicamento, una lista de medicamento. ¿Todavía necesita eso o ya no?
Pues la doctora Marixa.
Maria was living on the streets when they found her, and as a matter of fact, she had just suffered a head injury. She had been assaulted, and street medicine found her. They gave her care. Okay, pues gracias, María, y nos vemos, okay?
Bye.
If Maria lost Medi-Cal, she would be at risk of homelessness again. She would probably be in the hospital frequently, multiple times in a month. And she doesn't have a job, she doesn't have an income. So all of these things, healthcare is not something she can afford out of her own pocket.
In California, H.R. 1 created very significant problems for the state financially and how it approaches Medi-Cal.
Live look at the state capitol, where earlier today we learned California is facing a $12 billion budget deficit.
To balance the budget, the governor is proposing a pause in enrollment of undocumented immigrant adults into the state's Medi-Cal program.
Our approach was not to kick people off and not to roll back the expansion, but to level set on what we can do and what we can't do.
Every morning, I come into the clinic, and there is a line of dozens and dozens of people waiting to get healthcare services. I see that every day. Hey, I have a camera following me around. You know, I grew up during the AIDS pandemic. All of my friends were dying. There was nothing that anybody was doing about it as far as the government. I think it was really that incredible level of death and abandonment that I saw that showed me that the only way to deal with that is to fight. The community health centers are looking at losses of hundreds of millions of dollars in revenue. And that would be about a $50 million a year cut for St. John's. If we can't depend on the state or the federal government to serve the most vulnerable patients in our communities, we're going to have to do that ourselves on the local level.
Please give a loud welcome, Jim Magia.
Thank you. The healthcare cuts from the Trump administration are devastating. The California state cuts initiated by Governor Gavin Newsom, are even worse, eliminating health insurance for immigrant families across the state of California. So, I'm here to announce today that St. John's is bringing together a coalition to put a county initiative on the ballot, which would go directly to voters to save health care for our most vulnerable neighbors and use that revenue to restore the programs and health care our communities so desperately need.
That's tough. That is tough.
Oh, what do I do? What do you do? What do you do?
So the patient we were talking about earlier, he makes $3,000 a month, so he doesn't qualify for Medi-Cal, and he doesn't qualify for Recovery California because he's not undocumented. So he's in a situation now where the medications that are best to control his diabetes and prevent secondary effects of diabetes, he can't take because he can't afford it. So even though he makes enough that he's above the poverty line, he can't afford the medications. $600 a month is like a fifth of his man's income. Hola, señor. Make sure we get peach can I get 7 for him.
The Senate Committee on Budget and Fiscal Review will come to order. The oversight hearing today is about the impacts of H.R. 1 on California's safety net. H.R. 1 represents the most sweeping disruption to SNAP and Medicaid in the history of these federal entitlement programs. We're going to move to our list of senators. First is Senator Ciardo.
To criticize the federal government for trying to right-size their ship is, I think, a little hypocritical. Our Medi-Cal program since 2018-19 was gone from $93 billion to a current estimate of about $222 billion. That's a huge increase, and that's something that is not sustainable. Why is having somebody go out and do 20 hours of community service such a huge lift?
Senator Durazo.
Thank you very much. How many Californians are expected to lose their full scope coverage?
Our projections are that up to 3 million people losing coverage.
We're being asked to allow 3 million people to lose their health coverage.
It's a structurally imbalanced budget that we have to address, and we see it as an expenditure problem. So that is the administration's perspective.
The LA County Board of Supervisors is set to vote today on a proposal to place a half-cent sales tax increase on the June primary ballot. It is in response to the loss of federal funding.
We will now move on to item 15, securing funding to preserve critical county services, cut by H.R. 1, which was held by Supervisor Mitchell.
This motion gives the voters a choice, given the stark realities that our county is facing. We're talking about hospital closures, increased medical debt. The proposed ballot asks voters, are you willing to support a 0.5% general sales tax increase to preserve essential services that the County of LA provides you? The only question is, what will we do to create opportunity for the voters to step up to help save us all?
Since this appeared on the board agenda, my phone has been blowing up. They're in complete opposition to this tax measure. They're bringing up things like the affordability, right? Is this going to be even more expensive to live here and to shop here in LA County?
I think one of my frustrations is the state should have taken a lead, because this is not unique to LA County. You've got hospitals closing up in rural areas, and yet crickets. This is not new. We watch Sacramento, they sneeze, we get pneumonia. And that's what's happening.
And of people currently in danger of losing their access am nervous because two of the supervisors are wavering.
We will now vote on the ballot. Supervisor Mitchell?
Aye.
Supervisor Mitchell, aye. Supervisor Horvath?
Aye.
Supervisor Horvath, aye. Supervisor Hahn?
Aye.
Supervisor Hahn, aye. Supervisor Barger?
No.
Supervisor Barger, no. Supervisor Solis?
Aye.
Supervisor Solis, aye. Motion carries, 4 ayes, 1 no.
Everybody ready to celebrate a victory? It's now on the ballot for the voters to decide. There will be $1 billion coming into LA County to save health care if we win in June. That's what's saving LA.
In the mornings, when nobody's around, I try to focus on my breath and just focus on like the sounds surrounding me. Candy, I met her at a party when I was like 21. Got married like 6 years after that. 3 beautiful kids. Candy was very smart, outgoing, a good mom, funny, supportive, wasn't scared to live life. She was dope in everything. She was just excellent. She kept getting sick, throwing up. Menstrual cycle kept being longer than expected, all kind of crazy stuff. One day I came to visit her, she said, "Babe, they told me I have stage 4 cancer." She was 31 when she passed. She went out terrible. No peace, no nothing. This is in the 2000s, way before Obamacare. I truly believe if all this happened now, she'd have been fine. The sister failed my kids more than anything. Failed the whole family. That's one of the reasons why I'm doing this. For her, and because we've been stuck in survival mode so much. We're tired of it. We want to live.
The main intent of the Affordable Care Act was to expand insurance access in the United States. So the idea was to have a uniform coverage for low-income people in the United States, building on the long existing program of Medicaid. From the Republican point of view, the Affordable Care Act expansion of Medicaid violated the fundamental principles of Medicaid. Medicaid was to be a program for the most vulnerable, particularly women and children, and it was not intended in their eyes to be a program that provided health insurance coverage to able-bodied adults who should be able to go out and work and get a job and get their health insurance through a job. People on the left are accusing the Trump administration and Republicans of an intentional device to cut the program and to ensure that there are fewer people being covered. So far, the empirical evidence suggests that's exactly what's going to happen.
As a medical provider, we see the human experience. We don't see the paperwork, the legislature, and stuff like that. We just see the effects of it on our patients. And that's where the problem lies, is the people who put their pen to paper don't put the stethoscope to chest.
I think it's necessary to give exemptions to people who are experiencing disabilities, all kinds of categories of disabilities, not just the physical ones, but all of those things prevent you from having a job.
Where we're losing health care is through politics. So what is it? I can't see.
47.4% approval, and no is 52.
But it's still going up.
Yeah, tiny bit.
I'm feeling nervous, but hopeful. We're still down in the vote, but every batch that gets released, we're doing better.
No matter what side of the political spectrum you are, no matter what race you are, no matter what part of the country you are, most of us can't afford health care. And the little health care we get, we're struggling to hold on to it. None of us is asking for a handout. We're just asking for some dignity. Part of the American dream.